The COVID-19 virus has affected nearly all parts of Liberia, but thanks to the Ministry of Health and partners, the rate of the virus is low. Liberia recorded her first confirmed case of the virus on March 16, 2020, and the disease spread across the 15 counties very fast. A number of ideas and ways to stop the virus were soon put in place by the government of Liberia and her partners. One of the things done was to start giving the COVID-19 vaccination. As a result of national efforts through the EPR program, COVID-19 vaccines were slowly introduced at selected sites, firstly in Monrovia, and with limited involvement of the counties. Talking Drum Studio toured 18 communities in 5 counties of Liberia: Gbarpolu, Rivercess, Sinoe, Grand Kru, and River G. What do the people of these communities know about COVID-19 virus?
COVID-19 is a sickness that nobody shouldn't shake a friend's hand, wear your nose mask.
You hear that sneezing, coughing, and bleeding.
It can dry your blood when you cough. Then the virus can catch your friend.
Not good for shaking hands, playing with dead body.
The coronavirus, it can bring a lot of fever and malaria.
It's very dangerous. It kills some people.
COVID-19 vaccination.
I took it this year. It killed people.
I take my own last month.
I took the vaccine, September, Johnson & Johnson.
I did it a few months ago.
Then for the 100% in the town, I think almost 80% have come.
I took the vaccine.
For now, people are taking the vaccine.
I was the first to take it here. So you look at my car, it carries 0001.
No hospital here. Now we drink with clean water now. No pump. They say when I drink clean water, it will running our stomach. When your stomach running now, where you will go? No hospital. They can't set tablet here. We can use country minister and country minister enough for rare.
We don't have hospital in the community. The hospital is higher for the company.
Even when we're not pregnant, when down to labor, February, so now look for motorbike. Before reaching station, someone they get to labor.
To the hospital, no medicine there. And if you deliver there, they can charge you to pay money. And I can charge 3,000. And I can charge 4,000.
In a clinic, somebody can bring medicine for 2 to 3 days and finish.
We don't have clinic. If someone's sick here, the men have to put together and take the person to the biggest stand, which is hearing stand. Woman, when you pregnant, sometimes you'll be in your 7 months, 8 months. They carry you, they will keep you over there until God can bless you.
When the woman ready to give birth, even though we get women here that is trained, the woman check and no way, they have to put you on motorbike and carry you to the hospital. Because there is no extra cleaning around here.
If we come to the delivery of women within the town, it's risky. Sometimes the midwife will leave the clinic for 4, 5, 6 months, whilst you will leave the clinic for 2-3 weeks.
Always, there is no drugs in the facility. You read the paper and give it to them. And some people don't have money to buy drugs. So I would say they can find it hard to get treated. It's very hard because you don't put pregnant woman who the child already decent. You take that when you put on motorbike. The other issue is the community is not up to standard. No incinerator, no placenta pit. Just recently we have to dig another placenta pit. When it comes to drug issue, it's beyond our level.
The health issue, why it is true that the whole country facing the same thing. But for Grand Kru, we are worse because of the road condition in the southeast, where we have no mobile. The ambulance is just one. So if the ambulance went this way and a woman was in pain, maybe she was taken to the health facility where she needed to be referred to the hospital. No ambulance. The family will have to find motorbike for that woman in pain to ride motorbike and reach to the referral hospital. We don't have drugs. If anybody goes to the hospital, they will give you people. The government says health services are free of charge, but you spend more money now. And some people who don't have will go back home And apparently, something else may happen.
The road condition you see there, oftentimes we are challenged by that. For instance, if an ambulance has to go for a patient somewhere, the ambulance could get stuck while going or get stuck while bringing the patient. So the driver has to walk few hours in the network area and then call. So another ambulance will go there and get a patient. More time is of essence. You can get a patient at the facility in town, the patient could die.
We have major staff attrition in the county. We are supposed to come to the county at a particular point in time, it is delayed. It has been a major challenge, and I can tell you with the road. There are also challenges on logistics.
They have issues in the county, mostly about drugs and the workers. People sacrifice themselves, they come to Grand Kru and they are here, don't on pay road. They are volunteers. 5 months, 6 months, you can get paid. Only the incentives they are. How much is the incentives? These are the problem. And the drugs to reach to Grand Kru is very high.
The Minister of Health speaks to a lot of health and health-related issues.
Since the Omicron, we are seeing less death and people are infected, but they are not as critical as before. We are doing map up those who have not been vaccinated, will be vaccinated for us to reach that 70%. The more people that are vaccinated, the more the country is protected.
From the onset, there was this myth that centered around the COVID-19 vaccination administration. How did the ministry overcome such a challenge in getting the populace to be vaccinated?
Well, we worked along with the community because you need the community buy-in. The complaint that you heard was vaccine card. So we have to make sure we have vaccine card. We have mobile teams within the community that were even giving electronic vaccine card.
Supply of drugs. We've come to understand is a challenge.
The total amount of money that we need to purchase drugs for the entire country is almost 20 million plus. The government at this time, because of all of the competing priorities, have given us a small amount. So with that amount of money, we are dealing with manufacturers that not only deliver the drugs into the country to the port, but they deliver into the central medicine store. WFP is the one that delivers these drugs to the county.
Madam Minister, every county we visited, there are a lot of complaints on the part of patients. Even medical practitioners do have similar complaints regarding poor services, equipment. What is the ministry really doing to reduce this wave of complaints?
One of the issues is free system. Because if you go and we don't have the drug, we have to write a prescription. What we plan to do is charge a small amount of money for people to pay to get the drugs, and then we'll be able to turn it over. That way, we see that as the beginning of a way to curtail the shortage of drugs. And during this process, we will have community people involved.
Great. So low on staff is another challenge that was being noticed. Has this reached your attention?
There was a retirement process carried out. So we have been working diligently with Finance Ministry, CSA, to see how we can replace those that have retired with those who have been volunteering. So we want to make sure we capture all of these people that have been there for us in terms of servicing the public, and those spots that the people are not enough to be able to place people on payroll. But we have to work with CSA and Finance Ministry to make sure the funding is available, because if you put people there, you can't pay them, it's another problem. We keep meeting with Finance and CSA to make sure that we're giving them okay to put these people back to work.
How do you intend to sort of overcome those challenges?
Well, we have to first prioritize the issues, because you have to know you can't solve everything. You have to look at problems from the health practitioner side, a facility. Then you have to look at equipment within the facility. There's water, there's light. This is how we are tackling it. We're working with finance, we're working with the partners. The challenges are many, and we are tackling it one at a time.